following program is brought to you by Health Initiatives, Innovative Health Solutions. For more information, visit us at ccmhi.org.
Hello, I'm Dr. John Evans, an orthopedic surgeon, musculoskeletal consultant for Christian Care Medishare, and I'm here today to give you what I understand is one of the very best musculoskeletal workouts to get you in shape and keep you in shape, and it won't require any equipment. You'll notice I have no equipment here. The pool behind me is for later, not for now. What I'm going to show you is done with the idea that musculoskeletal problems are going to come to you unless you do something to prevent them. I'm going to show you a number of methods of avoiding musculoskeletal injuries and musculoskeletal degenerative disorders. But I'm going to start by showing you how you can do a preventive exercise program that will help you avoid headaches, neck pains, shoulder aches, elbow pain, low back pain, hip and thigh pain, knee pain. So this is going to be a rather comprehensive program of stretching, range of motion exercises, and strengthening exercises, all done without the use of any equipment except the body that God gave you. I'm going to start with the top and go down. I'm going to start with one of the most common problems that we deal with as orthopedic surgeons. That's neck pain. Degenerative disc disease is a problem that's very common to many people, particularly in North America. It's a vascular problem, and we're going to show you how you can avoid neck pain and prolong the time period that it takes to develop degenerative disc disease. Many people sitting at a desk get totally inadequate exercise for their necks. So what I'm going to show you is very simple to do. It will give you a range of motion for your neck, and then it will show you how to strengthen your neck so that you avoid the pain that begins in the superior trapezius muscle that inserts into the base of the skull. So here's how you do it. It's really quite simple. Just roll your head around like a ball on a chain. I usually do 10 repetitions going one direction and 10 in the other, taking it through a full range of motion. And you begin like this. Drop your head forward, roll it gently to the left, back, to the right, forward, back, left, to the right, forward, back, left, to the right, forward. You get the idea. I go 10 repetitions counterclockwise and then 10 repetitions clockwise. Again, forward, right, back, left, forward, right, back, left. You get the idea. 10 repetitions counterclockwise, 10 repetitions clockwise. That gives you a gentle range of motion to your zygoapophyseal joints and your superior trapezius muscle. Now we need to strengthen your superior trapezius muscle. Most people have totally inadequate trapezius muscles. Your trapezius muscle begins in your low back, goes out to your shoulders, comes in and inserts to the base of your skull on the back. And here's how you do the strengthening exercise. Interlock your fingers, put your hands behind the back of your head, push forward with your hands and backward with your head. Now in order to do it rhythmically, what I do is this. I do toe stands because I'm trying to be efficient with my time. I'm trying to get my exercise program in 30 minutes. So, pulling the hands forward, pushing the head backward, I begin toe exercises. 1, 2, 3, 4. You get the idea. I'm developing an isometric strengthening program for the back of my neck. Now, I do 25 of those. You can build up from whatever you're comfortable with to 25. And then move over to the right side of your head, push your hand to the left, and push your head to the right, and continue with the exercises. 1, 2, 3, 4, 5. And then move over to the left. 1, 2, 3, 4, 5. And then forward. I'm going to turn sideways so you can see what I'm doing. I put the palm of my hand against my forehead, my left hand on the back of my right elbow, and then I do the same thing. 1, 2, 3, 4, 5. I think it's worthwhile to vary your exercises, but strengthening your neck is vitally important. If you're having pain during the day when you're sitting at a computer or sitting at your desk, one of the things you must realize that you should be looking horizontal at the work that you're dealing with. So if you're reading a book, it's perfectly all right to pick up the book and get it so that it's more at eye level, so that you're not looking down at the book, causing neck pain. Whenever your neck muscles are tight, you momentarily cut off your circulation. And if you're staring down at a book for an extended period of time, you cut off the circulation to your superior trapezius muscle and produce an excessive amount of lactic acid, which then bathes the muscles of your neck and causes pain in the neck, and sometimes pain moving up to the base of the skull and over your head, which you may interpret as a headache. This is called a circumduction exercise, and it's designed to take care of a painful shoulder. Even when you're in pain, it will not do damage if you begin with a circumduction exercise. And here's how it's done. You put your right hand on a stable object such as a table or a desk, and then you back away until your hand or loose fist is just above floor level. And then by shifting your weight from left to right, you begin to naturally form a circle. I'm not moving my arm in a circular fashion. I'm simply shifting my weight left to right, left to right. And as I do that, my shoulder naturally goes into a circular fashion. Now, I do that with my left arm, and then I do it with the right. After I have done those circumduction exercises, which begin to loosen up the capsule or the covering for the joint, then I can do some more aggressive exercises. The next exercise for the shoulder is an exercise that begins to further loosen the capsule of the joint. And here's how it's done. You cross your arms in front of you, just like this, and you throw your arms down. They will naturally come up to this position. You give it a little boost at this point and down again, so that you get what I call a double windmill. I start out by doing 50 of these, sometimes 100, and this really limbers up my shoulders, and not only does it limber them up, it increases the circulation to the shoulder. So 50, and then gradually increase it until you're doing 100. Now you're developing an excellent range of motion to your shoulders, and you're increasing the circulation into the capsule of your joint. Once you've done this, you want to stretch the back side of your shoulder And here's how that's done. Simply take your right arm, swing it back and up and under your chin. Hold it, and then down, up, and under the chin. You see what you're doing? You're stretching the back part of your shoulder. It's 1, and hold it. 2, and hold it. 3, and hold it. 4, and hold it. 5, and hold it. 6, and hold it. You get the idea. Now we need to increase the range of motion for the back of our shoulders. And that's done in this fashion. And you simply shift from left to right as you do it. So you go back and up and over, hold it, down, up and over and hold it. You're once you get to the back part, reaching down low in your back, as low as you can, you're stretching out the posterior capsule of your joint. And here's how I do it. 1, and hold it. 2, and hold it. 3, and hold it. 4, and hold it. 5, and hold it. You get the idea. We're going to proceed down from the shoulders down to your thoracolumbar spine. And here's what you want to begin with. By lifting your arms up until your shoulder and bent elbow and fist are all parallel with the floor. You begin with a gentle range of motion like this. What you're doing is stretching the entire thoracolumbar spine. Actually, you're stretching and ranging them from the base of your skull down to your sacrum. And so I begin by doing 50 of these to limber up my back. And as you develop an improved stretching program, you can go further and further and take your head with you as you go. You get the idea. Now, the next thing we're going to do requires an explanation of why we're doing what we're doing. And the next thing we're going to do is take our thoracolumbar spine through a circular range of motion. But in order to protect your low back, we do it this way. Take your left hand and put it behind your back, all the way over, lean toward the left until you can get your hand out in the open, and put your left hand in front of your bent right elbow like this. Now we're going to work on our low back, but we've protected it by putting the low back in an extension position, and by having my arm behind my back, I keep it in an extended position even when I'm doing the circular exercises. And here's how it's done. With your feet about 2.5 to 3 feet apart, bend forward, put your chest down, go left, back, right, forward, left, back, right, forward. Do it in a smooth arc so that there's no real strain on your low back. Once you've done 10 repetitions counterclockwise, then you put your right arm behind your back to preserve your normal lumbar lordosis. Bring your right shoulder down and to the right. Put your right hand in front of your bent left elbow. Pull forward with your left elbow to maintain this extension to your low back, and then go in the opposite direction. I just point my finger forward. That tells me the direction I want to go. I squat about 30 degrees, put my chest down against my knees, right, back, left, forward, right, back, left, forward, right, back, left, forward. You get the idea. I start with 10 repetitions counterclockwise and then 10 repetitions clockwise or vice versa. I've limbered up my low back, and now I'm ready to do something to further limber the low back. What I do is this. I stand about 2.5 to 3 feet apart and put my arms straight out. And I'm going to go forward in a fashion that will stretch yet still protect my low back. And here's how it's done. Take your left hand and bend down and touch your right ankle and hold it. Come back up to the neutral position, bend down, touch your left ankle and hold it. And then I go to midfoot and hold it, back up to the neutral position, back down to the midfoot and hold it, back to the neutral position. Then great toe, then advance out to the middle toe and hold it, back to the neutral position, middle toe and hold it, little toe and hold it, neutral position, little toe and hold it. Now, we want to begin to work on the hip joint. And the hip joints are done in such a fashion that you're swinging your hip forward and backward and then side to side. And this will require my table again. I'm using the table for balance, and then I put my left hand out as a goal for striking my right foot against my left hand. I do it with my pelvis tilted just enough to keep my foot from dragging the carpet. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You may not want to start with your hand that high. You may want to start at a lower level, but start. That's the key. Now, just to show you the side-side motion, we do it this way. Move your hands for balance and swing your leg sideways. 1, 2, 3, 4, 5. You get the idea. What we're doing is moving the hip joint through a full range of motion that increases the circulation to the capsule of the joint and also increases the circulation to the articular cartilage through the synovial fluid to increase the health and nutrition of your synovial fluid. So you do that with your right leg, and you also do it with your left. We've started at the cervical spine. We're down now to the thighs. And here's what I would like to have you do to improve the strength to your thighs. It's quite simple, a half squat. And the way you do it, not a full squat, a half squat, you simply balance yourself and go down about 90 degrees with your knees, and you're simply using your arms for balance. Down, hold it, up. down, hold it, up. If you want to do it rhythmically, that's perfectly fine. Just like this. You're increasing the strength to your quadriceps and improving the circulation within the articular surface of your knees. What we're doing with this exercise is working on the muscles of the outside of the left side of my neck. At the same time, we're going to be doing some pendulum exercises for the knee to help lubricate the knee. And this is how the exercise is done. Push your head into your hand and swing your knee in this fashion. What I do is 25 of these rhythmically so that I'm getting good motion to my knee. At the same time, I'm working on my neck muscles, increasing the strength of the muscles on the left side of my neck. I do 25 of these, and then I shift to the other side. Put your right hand, the palm of your right hand just above your right ear. Balance yourself with your left hand and swing your knee in this fashion. You're getting the strengthening for your lateral neck muscles at the same time that you're getting good lubrication to the joint of your left knee. I do 25 repetitions each morning on this side. The next thing that you want to do is a good solid push-up. And you'll want to start with what you can comfortably handle and then gradually increase it. If you started with one push-up a day and you added one a week, at the end of the year you would be doing how many? 52 push-ups. And then in 2 years, 104. So, no problem about the rapidity with which you raise your repetitions. Start with what you can handle, but start. Any program that you do is far better than no program. So this program will allow you to do all of the strengthening, stretching, and range of motion exercises that you need to do. And here's how I do a push-up, because I don't want to irritate my median nerve, which goes under the volar carpal ligament. I do my push-ups on my knuckles. That way I'm not irritating my volar carpal ligament or the median nerve. And this is how I do it. I put my fists about 18 inches apart, and then I flatten my back out so that I'm perfectly straight, and I do my push-ups slowly. I go down and up. I'm not in any hurry. I breathe as I exercise. I usually start with just a few and gradually increase them. At this point, I'm working on my triceps. I'm working on my abdominal muscles, keeping my abdomen flat. And that's the way I do my push-ups. For a lady, you do it in a fashion that's slightly different, and you do it from the knees up, not from the toes up. And it's done this way.
What about lower back positioning?
Your low back is kept in a slight extended position because you don't want to put pressure on your front of your disc, making the degenerated disc material bulge out toward the back. So keep a small inward or forward bow of your low back in all of the exercises that you do. Let's talk about carpal tunnel syndrome. Your volar carpal ligament is a ligament that goes across the front of your wrist like a watch band. Underneath your volar carpal ligament are all of the flexor tendons for your fingers and your median nerve. Your median nerve supplies a sensation to your thumb, index, long finger, and the long finger side of your ring finger. Another nerve, the ulnar nerve, supplies the little finger and the little finger side of the ring finger. Now, there are basically two ways of handling a carpal tunnel syndrome, which is numbness, tingling, and pain in the distribution of the median nerve. One way is to go in and cut the band under which the nerve goes. Another way is simply to get the same effect by a careful stretching of the volar carpal ligament. And that's done this way. Take your wrist and bend it down to 90 degrees. Then take your fist of the opposite hand and push up at the same time you're pulling down with your right arm. I do this when I'm walking. I don't want it to look too strange walking down my street with my hand out here, but if you bring it in close to your chest, it's easy enough to do without bothering anyone. The other thing, you can utilize your walking to distract you from the discomfort that you might have from doing the exercise. So you can hold your wrist in that position very tightly without being aware of too much in the way of discomfort. What you're doing is this. Your medial epicondyle, this bony prominence at your elbow, is the attachment for the muscles that go down underneath the volar carpal ligament out to the terminal portion of your fingers. So when you bring the wrist down in this fashion and push up with your hand, the opposite hand, you're tugging with the tendons against the volar carpal ligament, stretching it. And if you do this for 5 to 10 minutes a day, you will begin to gradually stretch that volar carpal ligament so that it no longer is putting pressure on the median nerve. No longer are you having the tingling sensations in your thumb, index, ring finger, and half of your long, and you're able to sleep through the night. So, that's one portion of it. The other portion of taking care of your volar carpal ligament and your median nerve is to be sure that you're on a very spare diet, consisting primarily of fruit, vegetables, a few nuts, and some whole grain breads and cereals. If you concentrate on fruit and vegetables, you will be giving your volar carpal ligament and your median nerve the nutrition that they need to recover. So, this is what you're doing for your median nerve. Now, the next problem that's a common musculoskeletal complaint is lateral epicondylitis, or tennis elbow. Tennis elbow is really a function of the tendon that inserts into the lateral epicondyle of your elbow. And in order to prevent it or to recover from it, you must improve the circulation to your lateral epicondyle. A good way of doing that is with an ice massage. And I'm going to show you how to get your ice ready for the ice massage and then how to do it. But first, I'm going to show you how to do the strengthening for your tendons that insert into your lateral epicondyle. Not only will this help your lateral epicondyle, It will also help your shoulders. And that's done by placing your forearm across your abdomen, putting the back of your opposite elbow on the back of your hand, and forcing your elbow backward and resisting with your right hand. As you do this, you're strengthening and encouraging an improved circulation to your lateral epicondyle. I do this as a preventive measure. You can do the same thing. Now, notice while you're putting your elbow on the back of your right hand and pushing backwards, you're also working on your shoulder on the left side and some shoulder on the right side. So this is a part of your strengthening program, not only for your shoulders, but also for your lateral epicondyle. Now I'm going to take you in and we're going to show you how to do an ice massage. I'll show you how to do an ice massage for your shoulder as well as your elbow. So come on inside. Take an ordinary styrofoam cup, a 12 to 16 ounce styrofoam cup, and fill it with either crushed ice or ice cubes. We'll do that. I've learned that if you compress this, you will be able to keep the cup from cracking. So I tap it on the bottom, and as I tap it, the ice settles into the crevices, and I get a good compaction of my ice. When I tried it years ago, I would simply put it in with cubed ice or crushed ice, and fill it with water, and it would break the sides as it expanded. So I simply add cold water to the crushed ice, and now I'm ready to put it in the freezer compartment. Now I knew you were coming, so I already have one ready to go. So this one is for the next time. I usually keep one of these in the refrigerator, in the freezer compartment, because this is the greatest way I know of relieving musculoskeletal pain. So I'm going to take you into another room so that I can show you how I do the ice massage. Take a sharp knife and cut about 1.5 inches of the top rim off of the styrofoam cup. And discard the top rim. Now you have a big block of ice projecting out of the top of your styrofoam cup, and I'll show you how to do the ice massage for the lateral epicondyle. You can do the same thing for the shoulder, but this is just to get you started. Put the point of your elbow over the lavatory and just go in a circular fashion around your lateral epicondyle. Round and round. It's cool at first, but then it begins to get comfortable. I gently turn the styrofoam cup so that I have a smooth top or head to my ice cube. And as I do this, you'll begin to see the elbow is beginning to pink up. The reason it's pinking up is it is trying to keep the temperature of the elbow neutral or normal. And what it's doing is bringing a large amount of blood flow to the lateral epicondyle and to the common extensor tendon, which is the source of the pain for tennis elbow or lateral epicondylitis. I don't know whether the color is showing, but the temperature change is quite evident to me. And I do this for about 8 to 10 minutes. And as I do this, I have developed a significant improvement to the circulation to my common extensor tendon and the lateral epicondyle. Now, when you've used about an inch of this, you have sufficiently cooled down your elbow, and you'll notice that there is a little color change, and there's a significant calorie change in my elbow. The temperature is different. You can put this back in your freezer compartment, and you have 2 or possibly 3 more treatments for your elbow. Quite an inexpensive way to treat lateral epicondylitis or tennis elbow. Now for an ice massage for your shoulder. This is great relief for shoulder pain. What it does, it takes the circulation that goes underneath your arm and it brings the circulation out through the damaged, irritated tissue in your shoulder. And here's how it's done. You simply put the point of your elbow over the middle portion of your lavatory and then begin to go round and round as far as you can reach in the back, and you'll see the shoulder will begin to pink up quite quickly because you're increasing the blood flow to your skin. But the important thing is that the blood flow is not just going to the skin, it's coming from your axillary artery inside of your shoulder through the irritated tissues, bringing good nutrition and healing to those tissues. Remember what the scripture says? That the life is in the blood, and if you don't get the blood there, tissues begin to degenerate and die more rapidly. Pain begins to increase. So anything that you can do to increase the circulation to your parts will diminish the pain and delay the degeneration of the tendons and the cells. Some people have rotator cuff disorders that can be dramatically improved by doing an ice massage to their shoulder 10 minutes, 2 to 3 times a day. Think about it. 10 minutes, 2 to 3 times a day for several weeks may help you avoid an expensive, painful shoulder procedure. Yes, it will take a little time, and it will take some consistency on your part to do the exercises that we've described and the ice massage that I demonstrate. Remember, life, blood. The shoulder is beginning to pink up. After about 8 to 10 minutes, it will be very comfortable and very pink. When you've completed your ice massage, you have 2 to 3 treatments left in your cup. Again, not even the price of aspirin.
For more information, videos, or community support group, visit us online at ccmhi.org.